How many of you know somebody who's been suffering from back and leg pain and has been doing everything they can to get rid of it and restore their quality of life? How often do you see them wincing in pain, staying at home, missing important events with family and friends, all because they have this lingering pain or weakness that's drastically affecting their ability to perform their daily activities and enjoy their passions? Well, let me tell you about one of my favorite patients. His name is Tom, and he's a 71-year-old gentleman, former fireman, who made a living saving people's lives. Well, we did something for Tom. When Tom came to see me, he'd been suffering from back and leg pain for many years. He'd been doing the physical therapy, the oral medications, and the injections, and they all helped a little bit, but he never achieved sustained alleviation of his symptoms for any significant amount of time. And when he came to see me, he wanted solutions. We got some x-rays on Tom, we did a physical examination, and most importantly, we listened to him. If we look at his imaging here, we can see that he has some degeneration of the discs at L3-4 and L4-5. He also has some instability where the alignment of the spine is a little bit off, and just a little bit being off can have a tremendous negative impact on somebody's symptoms. We got an MRI on Tom as well, and his MRI showed that he had significant stenosis, which you can see right here, and also right here from a sideways point of view at L3-4 and L4-5. That, coupled with instability, this was leading to Tom not being able to live a very fulfilling life. And he wanted to see me, and we gave him answers. We ended up performing an anterior and a posterior fusion to stabilize the spine and also to decompress the nerve roots. Months have gone by since we operated on Tom, and he is back to enjoying life, back in the gym, and back taking care of his grandkids. Tom is just one example of the benefits of modern spine surgery. I'm a neurosurgeon. I'm a spine neurosurgeon. I love taking care of people. And when I can take care of people without surgery, I'm going to do it every time. But for people, when they come in to see me and they've done everything else, surgery may be an option. When people come to see me, just like Tom did, he was searching for answers. He was searching for hope. And that's why I'm trying to provide to all my patients, whether it's with surgery or without surgery. Either way, my number one priority is taking care of people.
Happy to join Dr. Kemp in discussing my case. My back problem was lower back pain in the lumbar region that had advanced to nearly constant static nerve pain in both legs. The sciatic pain would basically electrify, going all the way down to my ankles. And I reached a point of severity where I could do very little, had to stop going to the gym. I was unable to work in my wood shop, not able to plant a garden for the last couple of years. Couldn't use my farm equipment to keep up with my property or do much walking. When I did travel, unenjoyable. My initial effort for relief was to see a chiropractor near where I live, and that effort was short-lived. I was immediately referred to VSI by the chiropractor. When I called for an initial consultation, I was set up to see Dr. Kemp, and I was immediately impressed with his approach to diagnosis and treatment. After X-ray and MRI, he recommended a very conservative path forward to start. Initially, there were injections. Unfortunately, they provided no relief. In order to open up the nerve channel, he performed a laminectomy procedure, and that gave me relief on the right side. Interestingly enough, the left side was still a problem. So follow-up undertook further research to get more data, additional MRI, and it came down to indicating that a fusion was going to be needed to completely resolve my problem. While I agreed to proceed, I was very apprehensive, and I almost backed out of having the procedure. And I had actually called in order to cancel and had a conversation with one of Dr. Kemp's surgical PAs. And she was very reassuring. She certainly understood the hesitancy, and I said, leave me on the books. And I was really surprised later that same day, Dr. Kemp actually called me himself. And the conversation that we had gave me confidence that I needed to proceed, and I'm thankful that I did. As far as the recovery from the surgery, I had done a lot of on-site research regarding the recovery ahead of the procedure, and what I saw and read was a big part of my apprehension. So many that I saw had really struggled with the recovery. After the surgery, though, in my case, what I found is the first week or so at home were certainly challenging. The worst part was sleeping at night. I found I could sleep best in my recliner, and that's what I did for the first several weeks. The thing that helped me recover the most was walking. I walked the first thing every morning and then several additional times throughout the day, and the more I walked, honestly, the better I felt. And it was really, I think, the key to helping me turn the corner to get everything working the way it should again. As far as challenges now after the surgery, I'm now 8 months post-surgery and I'm completely pain-free. I've been back in the gym with a modified workout to slowly build back as the fusion continues to strengthen. I've been able to get to some projects started in my wood shop. I can now use my equipment again to keep up with my property. I even shoveled some snow in the last storm. I was able to enjoy some holiday travel this year, pain-free, with a lot of walking, and it was enjoyable. And I look forward to planting a garden again this spring. As far as my experience with VSI and Dr. Kemp and the care I received, I can't say enough good things. Dr. Kemp and his entire staff at VSI are friendly, they're competent, and they're clearly patient-focused in their approach to providing care. Quite simply, Dr. Kemp and his team gave me my life back, and I am so grateful that I was able to get the care that I did from Dr. Kemp, as well as the staff at Reston Hospital, where the surgical procedures took place. So I'm very appreciative. Those of you that may be out there considering a procedure, I can't recommend VSI, and in particular Dr. Kemp and his staff enough.